introduce Dr. Steve Kraus. We've glossed over this topic a bit throughout the day. He's going to talk about insurance reimbursement and parity and doing some amazing work. So please take it away.
Thank you. I'd like to thank Maha leadership for putting this together, and then the Chiropractic Hub leadership as well. I think this is a great way for us to get each state to advance their initiatives. If we can follow what Delaware has done, I think we'll all be in a better place. I'm gonna go over what not to do first. So, as mentioned, I'm Dr. Steve Kraus. I'm the chair of the Iowa Chiropractic Education Research Foundation. I'm also the past president immediate of the Iowa Chiropractic Society. I was also president back in 1995. So I think it's worth 1 minute of history here. Back in the 90s, we did not have the research. We didn't have the data to go bring to the legislature. We had a few studies, but we had a law passed in 1986 called the Iowa Insurance Equality Law, where we believed we should be paid equally as medical providers for same service. So what happened was we started discussions with insurance companies saying you're not paying us equally. It's just like Iran. Blue Cross Blue Shield kept promising this, promising that, and nothing ever happened. So in the end, we went to the legislature. They said, hey, we gave you the law in 1986. You're going to have to go fight it civilly. We've already given you the law. You've got the legislation. We go to the insurance commissioner. Insurance commissioner didn't want to agree with us. So we, in one of our 12th and 20th different discussions with the Blues, they finally said, and I was present for this in the late 90s, we're not going to change our reimbursement policy, sue us. So over the next 4 years, we raised $1 million from chiropractors. We entered into a 17-year lawsuit against the Blues in the state of Iowa, back and forth between district court. We went to the Iowa Supreme Court 3 times, and finally, here's what the Supreme Court said. You do have a law that says you're supposed to be covered for chiropractic services. So all third-party payers must cover chiropractic, but it doesn't exactly say you should be paid at an equal level. So then what we decided was, after, and this all just came to conclusion in the last couple of years, so then we said, well, we have to go back to the legislature now. So we looked at Nevada's law. I wish we would have looked at Delaware's law, but we still will. And what we decided to do through the Iowa Chiropractic Education Research Foundation was do studies to collect the data. Because I interviewed 5 different legislators, and I said, what would it take for you to pass a new law? What data do you need? What information do you need to be convincing? And they said, the insurance companies are going to claim that premiums are going to go way up. That's going to be their claim. So we need data. So we initiated 2 research studies. One of the studies was 2 surveys, surveying all the doctors of chiropractic in the state of Iowa, asking them, how is patient care impacted by barriers, by lower coverage, by visit caps, by limitations in the coverage? Is it impacting your outcomes? Is it impacting your care plans? Are patients following through? Is it impacting your business? And then we took surveys of thousands of Iowa citizens and collected data to get their opinion on, is it impacting your choice of provider? Are you going elsewhere for healthcare services? Does it impact how many visits you go to the chiropractor because you're not getting full coverage for it? And the answers were overwhelmingly yes to this is a problem. And patients said it's a problem, doctors said it's a problem. So those surveys were just concluded in May. We had hired a research team. They are putting all this together to get published in a peer-reviewed journal. We expect them to get submitted in September. And then this January, we expect to come forward with a new law. We've already been drafting the language. We are hopeful that we have been able to plug the holes, because here's what's going to happen. Insurance companies are going to find loopholes. They're going to find ways to get around it. So using AI, we asked AI to find all the loopholes that we fed into it. And because of that, we now have a much more detailed law to prevent that. So we're hopeful that in January, we are going to be able to get this law passed in the state of Iowa, and we think it can be a model for all the other states. But this Medicare Modernization Act is going to be critical for setting the stage, because one of the questions that these legislators ask is, what are the other states doing? So then the second study was on reimbursement. So thanks to Brad Cost and Infinity, they selected all the data for the state of Iowa and compared us to MDs, DOs, nurse practitioners, and physician assistants. And typically in the state of Iowa, PAs and ARNPs get paid 15% less than MDs. Well, chiropractors get paid 50% less than nurse practitioners and PAs, and almost 80% less than MDs. So the point is, data is going to help tell the story, and the legislators also asked us, what is Iowa like compared to states around us? So then we collected the data on the reimbursement from the clearinghouse for all the neighboring states around Iowa to show that DCs and other states are actually getting paid better than Iowa DCs when it came to x-rays and exams. And that's the real discriminatory section that we need to fight. So I just wanted to share with you that story so it can be a model, and that the legislative language that we've been able to craft, we think is extremely strong. We did not know about Delaware, so we are going to be calling you to fuse that together. So thank you.